California, land of beautiful beaches, movie stars, and surfers, is facing a harsh reality that could eventually affect the lifestyle of every one of its citizens. Burdened by a population of 35 million that's still growing, California is discovering that vital aspects of the state's healthcare system are seriously underfunded.
The crisis is imminent. In the past 10 years, 65 emergency departments have closed in California alone, with over 11 closing in 2004, including 2 trauma centers. So this seems to be kind of a snowballing effect where things are getting worse and worse.
In the past decade, 70 hospitals have closed due to financial losses.
This screen demonstrates the availability, or lack thereof, of our county hospitals to various services.
This display shows that almost every department in the public hospital system in Los Angeles County is overwhelmed.
We have hospitals today that are threatening to close that have 50,000 annual visits. One hospital, 50,000 annual visits. If that hospital closes, the patients have to go to the next place and the next place. Emergency rooms that are already overwhelmed.
It's like a balloon. I mean, you can't push in one area on a balloon without it expanding in another area. And so those patients that would have normally been treated at a county hospital or would have normally been treated at a private hospital that has now closed its doors, those patients haven't gone away.
With 25% of Los Angeles' population uninsured and about 33% underinsured, the cost of providing medical services to these groups has led to staggering financial losses for private and public facilities alike.
By July 1, 2006, the Los Angeles County Health Department will be $435 million in shortfall in their budget. By the year 2008, the shortfall will be $1.2 billion. So there are going to have to be laid out plans to close more public services, which will mean less access, greater pressure on the private sector, and I think more closures of hospitals.
And when uninsured people visit a private hospital's ER, they're evaluated and treated. But if they need ongoing care, the private hospital tries to transfer them to a public facility so they won't have to assume the financial burden. But even moving a patient is often a problem, since public hospital units are often filled too.
It doesn't take a rocket scientist to realize that with increased volume and no increase in space and lack of nursing staff, that the LA County system is going to be taxed beyond its capability.
And she has stairs that go up to her house. Okay. She walked up those stairs.
The domino effect of crowding in the ICUs and ERs can lead to a situation called diversion, which can seriously impact a patient's care.
What happens is that emergency room in Los Angeles and in many parts of the country has the ability to go on diversion. It's a request that the ambulances that have critical patients bypass that hospital and go to the next hospital. But it's only a request, because a hospital cannot close. Now, when that hospital goes on diversion for a while, and the paramedics go to the next hospital, before you know it, that one gets busy, and the next one gets busy. And in a geographic area, when all the hospitals are on diversion, then the paramedics go to the closest one. It doesn't matter how busy they are. When the paramedics arrive to the emergency room, the law says that they have to see that patient. So they're brought in by an ambulance and every bed is full. The paramedics wait along the wall. They stand there and they're waiting for an empty gurney to put their patient on off the ambulance gurney so that they can go out to the next call in their community that they're assigned to work for. They wait, and they wait.
Many factors contribute to the ongoing financial losses and closures of California's hospitals. State requirements for nurse-patient staffing ratios are proving costly to hospitals, as are mandated seismic retrofits for older buildings. California hospitals now must be as safe as possible from potential earthquakes. But a bigger reason is that payments from insurers and government programs have steadily fallen. Medi-Cal, California's version of Medicaid, provides the lowest per-patient reimbursement of any state in the country. The cumulative effect of these factors has hospitals and doctors that treat the poor in a financial death grip. Some doctors have stopped accepting Medi-Cal patients since they receive payment on only a small percentage of their charges. And many specialists now decline to be on ER call because it's simply not worth it.
Hold still, you're doing great.
Lack of specialists is a huge concern to the emergency department because we are where the sickest patients show up. You know, if we don't have those specialists available, patients may suffer and patients may die. And patients do die from the lack of specialty coverage that is becoming less and less available.
Some physicians say, I don't even want to do inpatient work, so they go to an outpatient center. They don't provide call coverage for emergency departments. They, in fact, would rather not be on the medical staff than provide coverage because in many cases they are required to provide the coverage, reimburse nothing for it, and have the malpractice liability associated with providing it.
A shrinking pool of dollars for hospitals and physicians, systems that discourage specialty care, and the alarming scarcity of emergency room and critical care hospital beds. All these factors make California's healthcare crisis a startling example of what could happen in the rest of the nation. When World Report continues, some alternatives that can work to help create fair and accessible healthcare systems.